Welcome to the deep dive. So you've shared some really interesting sources with us, all focused on kidney problems in animals,
Hmm.
specifically the ones they're born with or that show up super early, congenital and developmental renal diseases.
That's right.
Yeah. Now look, it's a pretty dense topic, a lot to take in.
You can be.
So our goal here is to kind of pull out the essentials, give you the key takeaways without getting totally bogged down in the technical jargon.
Exactly. Cut through the complexity a bit.
We're going to cover quite a range of things, from kidneys literally missing or in the wrong place
Uh-huh.
to problems with how they're built inside or how they actually work.
And there are some surprising connections, especially like why certain breeds get certain things.
Yeah, I saw that. We'll definitely get into that.
So fundamentally, we're talking about kidney abnormalities that are present right from the start.
Before birth or just after.
Precisely. Something happens during that, well, incredibly complex process of kidney development that throws it off track.
And that something can be genetic, inherited.
Very often, yes. But it could also be, other things impacting the kidneys as they're forming. Acquired factors, let's say.
Okay. So let's maybe unpack some of the specific conditions mentioned in the sources.
That's good.
First up, renal agenesis. That sounds, well, pretty clear. Born without a kidney, or maybe both.
Exactly. Absence of one or both kidneys. Straightforward definition.
Then renal dysplasia. The sources called it disorganized development.
Yeah, basically the kidney tissue doesn't form properly. It's structurally messy, you could say.
Gotcha. And renal ectopia. That's the misplaced kidney one.
Correct. Kidneys not in their usual spot. And sometimes they can even be fused together.
Ah, the horseshoe kidneys thing.
That's the one. So those are mostly about the physical structure, the morphology.
Right. But then there are issues with function, too, like glomerulopathy,
Yes, that's any disease affecting the glomeruli.
which are the kidney's filter space.
The key filter units, yeah. Crucial part. Then you have tubulointerstitial nephropathy. That involves the tubules, the little channels processing the fluid, and the tissue around them. It's generally a non-inflammatory disorder in this context.
And polycystic renal disease. Lots of cysts, I'm guessing.
You got it. Multiple fluid-filled sacs developing within the kidneys.
We also saw renal telangiectasia. Sounds vascular.
It is. Malformed small blood vessels in the kidney, and renal amyloidosis, that's protein deposits.
Abnormal proteins gumming up the works.
Essentially, yes, interfering with function.
Wow, okay. The list keeps going. Nephroblastoma, a congenital tumor.
Yep, a kidney tumor present at birth. And there's also multifocal renal citadinocarcinoma.
That sounds serious. Hereditary cancer in dogs.
That specific one, yes.
Yeah.
Seen in German Shepherds, for instance.
And then we get into the really specific functional problems. Fanconi syndrome. That seemed like a big one.
It is. It's a generalized issue with the tubules. They fail to reabsorb stuff they should.
Like glucose, phosphate, amino acids.
Exactly. All lost in the urine instead of being reclaimed.
Whereas primary renal glucosuria is just the glucose part.
Right. A more isolated defect. Just problems reabsorbing glucose.
And cystinuria. Too much cysteine amino acid in the urine.
Correct. Another specific transport defect, this time for cysteine and some related amino acids.
Okay, nearly there. Xanthinuria and hyperuricuria. Too much xanthine or uric acid.
Spot on. Excessive amounts of those substances in the urine due to metabolic issues.
And finally, primary hyperoxaluria leads to kidney stones from oxalate. Is that it?
Yeah, excessive oxalate can cause oxalate kidney stones and damage, and congenital nephrogenic diabetes insipidus.
Where the
Right.
kidneys just don't listen to the water balance hormone?
Pretty much. They don't respond properly to ADH, so the animal urinates excessively.
Phew, okay. That is quite a variety of ways things can go wrong with kidney development and function.
It really is. It highlights just how delicate that whole process is.
So what's the common thread here? Why do these things happen? It sounds like the developmental blueprint gets messed up easily.
That's a good way to put it. And a major theme, as you gathered from the sources, is genetics. Kidney formation in the embryo is incredibly complex. It needs this precise sequence of signals, genes turning on and off. Inherited mutations can just throw a wrench into that whole process.
Makes sense.
But it's important to remember, it's not always genetics. Non-genetic factors can also hit those developing kidneys, either during pregnancy or right after birth.
Okay, let's circle back to the genetics, though, because that's where those breed connections come in, right? It was striking how many specific breeds were listed for particular conditions.
Absolutely. It really shows the impact of selective breeding over generations. You concentrate certain genes, sometimes unknowingly carrying these risks.
So, for example, renal agenesis missing kidneys, the sources mentioned beagles and Doberman.
They did, yeah. Reported more often in those breeds. And renal dysplasia, that disorganized structure.
That seemed to be in loads of breeds, Alaskan Malamutes, Shih Tzus.
A really wide range for dysplasia, yes. And glomerulopathy, affecting the filters.
Also a long list. Beagles again, Bernese Mountain Dogs, Cockers, Newfies.
Many, many breeds. Kind of makes you wonder about shared ancestry or maybe certain genetic pathways being vulnerable across different lines, doesn't it?
It does, and polycystic renal disease, PKD, famous in Persians, obviously.
The classic example for cats.
But the sources said dogs too. Beagles, Cairn Terriers.
That's right, it's not exclusive to cats.
Huh.
Then renal telangiectasia, the blood vessel issue, Pembroke Welsh Corgis were mentioned.
Okay. And amyloidosis, the protein deposits, more common in certain cats like Abyssinians and Siamese.
Yes, and also Shar-Pei dogs are known for amyloidosis issues, often associated with their fever syndrome.
Right. And you mentioned German Shepherds for that hereditary cancer, the cystadenocarcinoma.
Correct. It really paints a picture of how breed history shapes these health risks.
Definitely. What about the functional issues? Fanconi.
Basenjis are the poster child for Fanconi syndrome, but border terrier is also mentioned. Affects those tubules.
And the specific glucose issue, primary renal glucosuria?
Norwegian elk hounds, Scottish terriers pop up there.
Cystinuria, the cysteine excretion problem.
Oh, that list was long. Australian cattle dogs, Newfoundlands, Dachshunds, Mastiffs, even some cats.
Wow. And Dalmatians and hyperuricuria, too much uric acid. That's almost common knowledge, isn't it?
It's a very well-documented classic breed predisposition. So yeah, these examples really hammer home the genetic link for many of these conditions.
So if you, the listener, have one of these breeds, it's definitely something to, well, keep in the back of your mind.
Worth being aware of, for sure.
So overall, while maybe these specific congenital problems aren't seen every single day,
Right. Not super common across the board.
they do tend to cluster within families, within certain bloodlines.
Exactly. They show up more frequently in related animals across generations.
Affects both dogs and cats, and those family links are key.
Definitely.
And it seems like diagnosis often happens relatively early, like before age 5.
That's the general trend, yes.
Yeah.
Fits with the congenital or early developmental nature.
Any differences between males and females?
Sometimes, yeah. The sources mentioned a few. Familial cystinuria seems more common in male dogs.
It's okay.
Samoy hereditary glomerulopathy, also more males affected. But then, familial glomerulonephropathy in Bernese Mountain Dogs, more common in females.
Interesting. Those little details might help point a vet in the right direction sometimes.
They can be pieces of the puzzle, yeah.
So for a pet owner listening, what might they actually see? What are the signs that something like this could be going on? Any red flags?
Well, that's the tricky part. Often, the early signs are, well, they're pretty vague.
Like what?
Things easily mistaken for just, general kidney disease that develops later. Increased thirst, drinking more water, urinating more often. Those are classic signs of kidney trouble, congenital or not.
Okay. Anything more specific?
Sometimes.
Yeah.
With certain glomerulopathies where they lose a lot of protein,
Right.
you might see a swollen belly from fluid or even swollen legs. Abdominal distension could also happen with really big polycystic kidneys or tumors.
And pain. Or blood.
Yeah, blood in the urine or signs of abdominal pain could potentially happen with telangiectasia, those vessel issues, or with tumors.
But you mentioned earlier some conditions might show no signs at all.
Absolutely. That's a key point from the sources. An animal born with just one kidney, for example.
Unilateral agenesis.
Right. Or one that's ectopic in the wrong place. They might be totally fine, completely asymptomatic their whole life.
Wow.
Same for some of those isolated tubular transport defects. No outward signs unless a complication pops up later.
Like kidney stones or something.
Exactly. So on a physical exams, the vet might find signs linked to chronic kidney failure in general, maybe that fluid buildup, or sometimes they might feel enlarged kidneys or an abdominal mass if it's PKD or a tumor or fused ectopic kidneys.
Okay. We've talked a lot about the genetics, but you mentioned non-hereditary causes too. Can we quickly touch on those again? What external things can cause problems?
Sure. Well, genes are often the main story. Things like certain viral infections during development.
Like panleukopenia in cats or herpes virus in dogs.
Yeah, those have been linked to renal dysplasia. Also, certain drugs given during pregnancy or early life.
Which ones?
Things like some corticosteroids, daphnelamine, biphenyls associated with polycystic kidneys, others like chlorambucil, Sodium arsenate potentially linked to renal
Like
agenesis.
the diet, vitamin imbalances.
Yes, particularly extremes of vitamin A too much or too little during development have been suggested as a possible factor in renal ectopia. So it's not just genes.
Right, it's complex. So, okay, diagnosis. When a vet suspects one of these issues, how do they figure it out?
Sounds like it needs a thorough approach.
Totally. It's a multi-step process. First, you've got to rule out the more common things: acquired kidney disease, other stuff causing similar signs.
Makes sense?
Then the standard workup: blood tests, CBC, biochemistry, and a really good look at the urine, the urinalysis.
What do those tell you?
A ton.
Okay.
Anemia can show up with chronic failure, high waste products in the blood, obviously, whether the kidneys can still concentrate urine.
Protein in the urine is a big one, especially with low blood albumin and high cholesterol that signals nephrotic syndrome.
And you mentioned specific clues, like glucose in the urine.
Yeah, finding glucose in urine when the blood glucose is normal, that screams Fanconi or primary glucosuria. And seeing specific crystals can point right at cystinuria or hyperuricuria.
And thankfully, diagnostic tools are getting better, right? Genetic tests.
Huge advancement. The sources specifically mention tests available for familial nephropathy in English cockers,
Okay,
cystinuria in Newfies, and PKD in Persians and related breeds.
that's great. Direct answer sometimes.
Incredibly valuable, yeah, for diagnosis, early detection, and guiding breeding, too. And then there's imaging.
X-rays, ultrasound.
Yeah, exactly. Radiography, ultrasonography, sometimes contrast studies like urography. They let you see the kidneys, size, shape, internal structure, look for cysts, masses, weird locations.
And if things are still unclear, biopsy.
That's the next step, yeah. A kidney biopsy, taking a small tissue sample to look at under the microscope.
Gives a definitive answer.
Often, yes. You can see specific changes, like immature fetal-looking glomeruli in dysplasia,
Oh,
or the characteristic changes of different glomerulopathies, the fibrous tissue in tubulointerstitial disease, the actual cysts in PKD, those malformed vessels in telangiectasia.
even tumor cells, I guess.
Exactly. Or even the oxalate crystals deposited in the tissue in primary hyperoxaluria. Microscopy can be very specific.
Okay, so once you have a diagnosis, what about treatment? Can you actually fix these congenital problems?
Unfortunately, usually not, because the problem is fundamentally developmental or genetic.
Right.
You can't really reverse it. So treatment becomes about supportive and symptomatic care.
Managing the consequences, basically.
Precisely. The goal is to improve quality of life, try to slow down any decline in kidney function, manage complications.
Oh, diet, meds?
Often involves special kidney-friendly diets, yes. Medications maybe for nausea or high blood pressure if that develops. Fluids sometimes. And really close monitoring regular blood and urine checks.
And you have to be careful with other medications, right?
Absolutely crucial. Avoid drugs known to be tough on the kidneys, nephrotoxic drugs.
Right.
And for any drugs that the kidneys normally clear from the body, the dose often needs careful adjustment because the kidneys aren't working at full capacity.
Makes sense. What about prevention, then? If you can't really treat the underlying issue
Prevention really comes down to breeding.
because of the strong genetic link.
Exactly. The most effective way to prevent these in the long run is responsible breeding. Don't breed animals known to be affected.
Or carriers, if there's a test.
Or carriers, absolutely. Identifying those animals, using genetic tests where possible, looking carefully at family health history, that's key to reducing how often these pop up.
Gotcha. So what are the potential downsides, the complications, and what's the general outlook for an animal diagnosed with one of these?
Well, the complications can be pretty much the same as you see with any kidney disease. Developing acute kidney failure, or, more commonly, progressive chronic kidney failure. That nephrotic syndrome with the protein loss.
Right.
Kidney stones or bladder stones. Blockages. Higher risk of urinary tract infections.
Okay. And the prognosis, how well do they do?
It's really, really variable. Depends hugely on the specific condition, how much damage there is already, how severe the dysfunction is.
So some might do okay for a while.
Definitely. Many of these are irreversible progressive conditions, yes. But some animals, especially with milder forms or good management, can stay quite stable and have a good quality of life for a long time.
That's good to hear.
And remember, some conditions like having just one kidney, or an ectopic one, or maybe primary renal glucosuria or cystinuria, if stones don't form, might never cause serious illness unless a complication arises later on.
Right. So it's not always a terrible diagnosis immediately.
Not always, no. Depends very much on the specifics.
Okay. So wrapping this up, It seems like congenital and developmental renal diseases are, well, a really mixed bag of conditions affecting animals right from the start.
A very diverse group, yeah.
Genetics seems to be a huge player for many of them.
Often central, yes.
And while cures aren't really on the table, careful diagnosis and good supportive management can make a big difference to their well-being.
That sums it up well. And I think that point about predispositions,
Mhm.
which came through so clearly in the sources,
Yeah, that was striking.
that's a really crucial takeaway for owners and breeders. Knowing the risks associated with certain breeds helps with early detection and making informed choices.
Absolutely. So here's a final thought for you to maybe chew on after this. We've talked so much about the genetic component in these kidney issues. What does that mean, bigger picture? What are the sort of ethical thoughts or future possibilities around genetic screening and managing these conditions within breeds?
Hmm.
It really makes you think about that deep connection between an animal's genes and its health across its whole life, doesn't it? And where veterinary medicine might go next with all this genetic insight. Something to ponder.